Hi, I'm here with Patrick today, who graduated from the B.S.P.S program in 2016. He's currently a health policy advisor for the House Budget Committee Republicans at the US House of Representatives. Patrick previously worked in the pharmaceutical industry as a research associate for Pfizer and Sanofi Genzyme. Thank you so much for being here to speak with me today, Patrick.
Thank you for having me.
Of course. First of all, can you tell us a little bit about what you're doing in your career at the moment and how you got there?
Sure. So as you mentioned, I'm a health policy advisor for the House Committee on Budget in the House of Representatives down in Washington, D.C. In this role, I, as the name implies, advise certain members of Congress on healthcare related policy, specifically working on the Budget Committee now. It generally deals with the cost of it, the federal budget, the long-term solvency of certain programs like Medicare, Medicaid, and solutions we could do to reform it to make sure that the government-derived healthcare and other programs that we have can best serve Americans all across the country. I graduated from the College of Pharmacy at URI, studied pharmaceutical sciences. I worked in a lab for almost a decade. So the research science really was my upbringing in the healthcare and scientific community. So with the work I do now, it certainly still is healthcare, just healthcare policy and kind of guiding different reforms that down the line do affect the job I had before as a research scientist in the pharmaceutical industry. So how did I make that transition? There's a lot of different ways one can. I did it primarily by networking with a lot of folks who were kind of working in the field that I have now when I was a scientist. And to them, they thought, oh, that was so cool, because most people in the field I work in now don't have research science background, let alone even some private industry. They may have worked in government their whole careers. So coming with that outside perspective and a niche scientific research background was a draw to a lot of people. At the bare minimum, letting them know that, hey, this guy must be smart and competent enough to learn this new job. But I had to do a lot of self-education, online resources, getting coffees and networking with people. Those were probably the main things. I've been in DC now for just over 2 years, and when you go here, there's a whole ladder system you kind of have to climb up. So definitely had my time doing that. But back in when I worked for Sanofi, was my last research job. At the same time, I was still talking with, that was in Boston, Massachusetts. I was networking with people in the Massachusetts state legislature and some of the healthcare staffers there. I flew down to DC to visit a friend and also met with some of the lobbyists that worked for Sanofi at the time, and just kind of had conversations and let people know that I was interested in transitioning to this. And in a lot of different careers, definitely in politics or policy, the more you network with people and let them know, you're interested in something, the more apt they are to help you, because it can help them later on the line.
Yeah, definitely. I think a couple of other alumni have mentioned that networking was really key for them. A number of them have had like one job straight after graduation, and then to change to their second job, they got that based on networking. So it's definitely important to kind of start building that up as soon as you can, really. Not necessarily just because you might fancy a career change, but just because it's good to build that network up regardless.
Absolutely. And URI Alumni Association and the specifics within the College of Pharmacy do a great job with that. There's an alumni presence here in DC for the basketball team plays a couple of other schools in the area here, so we've gotten together. There's actually a professor at University of Rhode Island, a nursing professor who serves on MedPAC, which is the Medicare Payment Advisory Commission, which advises Congress on certain Medicare policy changes, and we're connected. So there's a lot of different ways that you could, through just URI, and then once you actually start your career in the private industry or elsewhere, the connections really can help you in your current role and to help get to your next one.
Yeah, thank you. That's a really good insight. Can we talk a little bit about the B.S.P.S program? What would you say your favorite aspect of it was?
Absolutely. I'm sure many of the faculty and staff would admit that it was still even in its infancy. When I was going through the program, I think my graduating class just had 20 to 25 individuals, so still very small. And I know it's grown, but it's grown through feedback from previous students and from, again, outside faculty and staff and alumni who then work in industry or in different lab experiences, and they could give the great insight into specific classes, pharmacology, pharmacokinetics, medicinal chemistry. Those aren't typical classes that undergraduate individuals would take at other universities if they're just studying a general biochemistry program. So the specific pharmaceutical relation of the program was a huge draw to me. And the fact that we had such great lab experience, again, at the undergraduate level, both through the curriculum and some of the lab courses we had there, and then the opportunity to work in graduate research labs as an undergraduate assistant. The research that happens at URI College of Pharmacy makes nationwide news for their successes. And being able to be an undergraduate helping out in that field, as many do, is a really unique opportunity. I got to do that twice with two of my professors, one doing cancer research and one synthesizing oligonucleotides and trying to replicate an assay from another lab out in California. So, and that was many years ago, but the fact that you were able to be hands-on doing this research, I was treating cell lines, and then I was running HPLC, again, at that more novice undergraduate level, but getting to actually learn it, do it hands-on, have it on the resume, definitely helped get my first jobs at Pfizer, where I worked with cell lines there and liver microsomes, and then at Sanofi after, where I was a bioanalytical scientist doing HPLC mass spec analysis, both of which I had previous experience in my undergraduate studies, which not many folks can say.
Yeah, that's a prime example of how being involved in an undergraduate research lab position helped you in your career directly. Finally, then, what advice would you give to BSPS students regarding the opportunities that are available to them here in the College of Pharmacy?
Well, the first thing would be that there are many opportunities. The BSPS program by nature is pretty specific. And you might have in your head that, you're just going to further into grad school, or you could get a private sector research job after graduation, those, or maybe even continue careers into the PharmD program. Those are kind of top options, but there really are many others. And even if you start off going on to grad school or going and working in the private sector in whatever capacity, you can still do a career change later down the road. I learned, not too quickly, but kind of medium on that. I like this research a lot. I'm good at it. I was well prepared from my studies, but I don't think it's the best use of my skills, which is understanding the specifics of science and healthcare. But what I found was a better use of my skills was then translating that to other people, and through communication and translating the in-depth scientific material to layman's terms, and then eventually advocating for certain changes with it and policy. That's what I'm passionate about, and my innate skills plus my education has helped me do that. So that could be the same for many other people. If you have a background in this science, you're going through the BSPS program, clearly you must be passionate enough about it, but you might have some other skill that you never really think you can cross with your science passion and education, and I can't even theorize what that may be, but you may find that later on, and I would absolutely recommend and advocate for people to find ways of taking this in-depth healthcare and science research that we learn, but then pairing it with some other passions you have and trying to make a career out of that. If it doesn't work right away, continue on to school, go find your entry-level job, get some real-world experience that's different from academia. I think that helps a lot of people, but you could always make a career change later on in life. And to tie it back with the beginning of our conversation, the networking and continuing conversations with other people who may have had similar career paths or completely different ones is always very valuable.
Thank you so much. I've really enjoyed this conversation. I think it'll be really useful to a lot of our students. So I really appreciate your time.
Yeah, you as well. Thank you for the questions and happy to give back.